LawrenceHits.com, it's Jaywalks, and today we're talking with Don Barkley of Truly Affordable Health Insurance. And this is one of those times where the name of a business actually is an accurate descriptor of what you do. You provide truly affordable health insurance. How long have you been in the insurance business, Don?
Good morning, Jay. Well, I'm kind of a newcomer, really. I've had a long career in other things, and I finally got into insurance about 3 years ago. And I did that because my father had a life-threatening illness, and I wanted to do something to help seniors. So I got into the insurance business to help seniors.
Well, that's a perfect jumping off point for the conversation, and we'll get back to the health insurance aspect for the general public, but the senior market represents adults over the age of 55.
65.
65.
Yes.
Okay, I'm sorry. So adults over the age of 65, and typically these are people who are receiving Medicare.
Usually, yes.
Right. But Medicare does not cover everything.
It does not, and a lot of people don't know that. Medicare doesn't pay for dental and vision insurance. Medicare doesn't pay for home health care in a lot of cases. There is a caveat in the Medicare plan where they'll pay for some of that based on specific conditions, but only for a little while. And so we provide a home health care plan as well. We also provide accident insurance and supplemental plans so that if they have a Medicare supplement with a deductible, our plan will actually pay the deductible, and they may end up with cash in their pocket.
Why is it so important for seniors over the age of 65 to consider these supplements? Some people will argue that, insurance providers tend to target seniors and frighten them into these policies, but there's a valid reason. What is that reason?
Well, I'm glad you brought that up, because one of the reasons I avoided the insurance industry for so long was because I didn't want to frighten anyone into buying anything, and to me that's what it was about. But it's really not. It's about helping them cover expenses that the insurance does not cover, the Medicare plans don't cover. So, not to go into too much detail, but Part B of a Medicare plan is an 80-20 plan. So there's 20% exposure there, and that's what a Medicare supplement plan, also called a Medigap plan, that's what it's designed to do.
Is to cover that 20%.
Correct.
Because most of the time, seniors over the age of 65 are on a fixed income.
Sure.
And additional expenses that are not planned for can become a burden.
And there's no way to predict how much it's going to be.
Right.
So it's not only unplanned, but it's an unpredictable amount.
Well, and the other reason behind it is that after 65 and progressively more as time goes on, unforeseen things just tend to happen.
Yes, they do.
and these are accidents that if they happen to somebody in their 30s or 40s, they're a lot easier to recover from than
right.
when you're in your 70s or 80s. And I'll give you a perfect example. My aunt is 92 years old. She fell. She shattered her shoulder to the point where it had to be completely replaced.
Wow.
Medicare did not cover that injury. Had she had something that would have covered that injury, she wouldn't have bared the out-of-pocket expense.
And one of the things that people don't know is that every 48 seconds, somebody in the United States files for bankruptcy specifically due to medical costs, because there are so many holes in Medicare and in major medical plans that they don't realize are there, that they end up with huge medical bills and they can't pay them.
So healthcare becomes a burden rather than a point of help. So let's talk a little bit about the truly affordable health insurance that is truly affordable for people of all ages, because it's an interesting spectrum. You have people over the age of 65 living on a fixed income, can't afford all of these extras, but then you also have people under the age of 30 who find themselves in the same boat.
Sure. Well, and one of the things I find with people that are under the age of 30 is a lot of them don't understand the value of insurance, and they think they can just do without because, of course, when we're that age, we're bulletproof and we'll be fine, we think.
Right.
That's not a true statement, but that's what everybody thinks. So what we offer is for anybody under 65, and it's actually clear down to newborns, we offer health insurance plans off the exchange. I tell people that I rescue people from Obamacare because typically we can offer a coverage plan that covers anything that would and then some for about 25 to 50% less money with lower deductibles. In fact, a lot of times they're zero. And what they're finding on the marketplace, the people that I talk to every day are paying somewhere between $300 and $900 a month for their health insurance premiums, in some cases more, with a $3,000 to $10,000 deductible. Mm-hmm. And so they don't go to the doctor because they can't afford the deductible. So the health insurance, the exchange, the way it's put together, encourages people to not go to the doctor, because to get a plan they can afford, which is at the low end of the spectrum, it's a bronze plan, it's only 60/40 coverage, it's the cheapest monthly premium, but it's the highest deductible, right. So they don't use it.
The original intent of Obamacare was very noble.
Sure.
However, it didn't turn out the way everyone had hoped it would.
It did not.
And regardless of your political persuasions, having an alternative is very important. So in most circumstances, when you go to file your taxes, if you do not have or cannot prove that you have insurance, you will pay a tax penalty.
Correct.
Truly affordable health insurance offers a way to not pay the tax penalty.
We do, and it's a much more affordable plan. It's better coverage, and people need to understand that the penalty is still in place for 2018. And in 2019, the penalty is still there, but it goes to $0. Mm-hmm. And I want to remind everyone that that happened with the stroke of a pen. So with the stroke of a different pen,
it could be undone.
Anything
Absolutely.
else. It could be anything else.
So as we think about what you do, you list yourself as an independent insurance professional. What does the word independent mean?
It means that I'm not a captive agent. And what that really means is that I'm not an employee of any insurance company. I can sell whatever I want to. I choose to partner with one specific company most of the time. Sometimes I bundle that with other pieces, but I choose that because I think it's the best available coverage for people at the best price, and that's why I use them.
Okay. Now, here's the next question. We've addressed the premiums are lower. We've addressed low or no deductible. We've addressed no tax penalty. But one of the things that plagues people is having to wait for that window of enrollment to open. And if you miss it because something happened, you got to wait another year or
right.
another 6 months.
Right.
What's the situation with truly affordable health insurance?
Well, since we are off the exchange, we don't play by their rules, and we don't have to. It's legally not playing by their rules. So open enrollment is every day. We are open for business 365 days a year, and if you want to sign up for insurance, you can do that.
That's amazing. I have always been hesitant to change my coverage because I am very comfortable with my physician. I have had the same physician now for 7 years, and I hope to have him for 7 more years. So if I were to make a change, would I have to change my doctor?
Absolutely not, Jay. The plans that I use are nationwide, and in fact, they are worldwide. So you can go to any doctor and any hospital you want to go to, doesn't matter where it is. Now, the way that works is that if they're in country, we'll just pay them directly. Just like if you handed them your normal insurance card, you hand them our card, we pay them directly. Same scenario as always. If you're in some other part of the world and they don't recognize your insurance, which would be true with probably any carrier here, we will reimburse you at the same full benefit rate as we would have done for the doctor or hospital. Now, you may have to pay those bills while you're out of country, which is why I recommend travel insurance. But once those are paid, you send those bills to us and we'll pay you the full benefit, just like we would have paid the doctor.
So for people who are considering insurance, because the list of things that we can insure is a very long list, it's a risk factor analysis.
Sure,
it's, what is the chance that this will happen? Do you guide people through that process?
I kind of do. I go through a list of questions with them, and I want to get a feel for their lifestyle, their health history, all of those things, so that we can choose the right products to put together for them that fit their lifestyle and their budget. And that's why we go and sit down at people's kitchen table with them, and I'll spend 2 hours with them at no cost whatsoever to put together a good plan for them.
Sure.
Because I want to understand what's best for them.
Now, can I shop off the menu, or do I have to buy the package?
No, you can absolutely buy anything off the menu you want.
Okay, so if I only wanted, let's say, dental and vision care, I could get that without having to buy hospitalization?
Absolutely.
Okay.
And anytime during the year that you want to make a change to that, you can do that as well.
And is there a benefit to buying a package, though? Will I save a little bit of money?
Not really.
Okay.
Maybe a policy fee or two,
right.
$25 or so. But one of the great things about doing insurance this way is that if you decide that today you only want dental and vision, you can get that. And 3 months from now you decide you want a hospital plan, you can add that. And 6 months later you decide you want an accident plan, you can add that.
Okay. All right. So it can be something that is evolutionary and changes can be made at any time.
Absolutely. And there's no penalty for doing that.
I think the thing that impresses me the most about Don Barkley, folks, is that the initial consultation is free. And I don't know about you, but I find the world of insurance often to be confusing and overwhelming. And just having the ability to talk with somebody who is in the weeds, so to speak, makes a big difference as we consider what's right for ourselves and our family.
Sure. One of the biggest things that I want to impress on people is that they do have options. They are not tied to a program that doesn't work for them.
Well, I think that that's probably the most important thing that should be remembered out of this conversation, is that you can make changes without hurting yourself. And in fact, in most cases, you will help yourself. So it starts with a conversation with Don Barkley. And again, there's no charge for the initial conversation. And his number, write this down, gang, 785-979-0722. Again, 785-979-0722, 979-0722. Again, last 4 digits, 0722. Don Barkley with truly affordable health insurance.
Thanks, Jay. I appreciate it.
Thanks for being with us today. You're listening to LawrenceHits.com.